Okay, it's 9 o'clock. I would like to call the May 24th meeting of the CAC Public Health and Community Impact Subcommittee to order. Moderator, can you please call the roll?
I certainly can. Good morning. Chair Mathey, you are present.
Present.
Member Bauer. Member Christensen. Member Tupy.
Present.
And Member Woolsey.
Present.
Excellent. So we have a quorum of 3.
Thank you, moderator. Members, the first item on our agenda this morning is public comment on items not on the agenda. Moderator, can you please open up the floor for public comment?
Yes. All right. We are now taking public comment on agenda item number 2, which is for items not on the agenda today. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. You'll have 2 minutes to speak with a 30-second warning. When your time is up, you'll be muted, and we will move on to the next request for comment. Each member of the public will have 1 opportunity to speak on each agenda item. And at this time, I am not seeing any requests for public comment. Would anybody like to make public comment on items not on today's agenda? Chair Matha, it doesn't look like anyone would like to make comment. So would you like me to close public comment?
Yes, great. Okay. All right, so we'll close public comment. And move on to agenda item number 3. So I'm very excited today to have 2 special guests here to share information with us on THC concentration. The first is Dr. Beatrice Carlini. And Dr. Carlini is I want to tell you a little bit about her. She's an acting assistant professor at the Addictions, Drug, and Alcohol Institute in the Department of Psychiatry and Behavioral Sciences at the University of Washington in Seattle. And her research career has been dedicated to understanding the public health impact of legal psychoactive substances and policies and substance control policies on social and health outcomes. And so her work includes alcohol, inhalants, tobacco, and cannabis. And since 2016, Dr. Carlini has been the director of the Institute's Cannabis Research and Education Program, where she focuses on conducting cannabis research that assists Washington community-based agencies, government agencies, and policymakers in making decisions and setting priorities. Dr. Carlini has been a pioneer in bringing awareness of the sharp increase in the availability and risks of high THC content products brought by cannabis legalization in Washington. And one of the main reasons I wanted her to speak with us today is because in 2020, she chaired a cannabis concentration working group composed of scientific experts who authored a consensus statement and report on cannabis concentration and health risks for the state of Washington. And that led in 2021 and 2022 to a contract with the Washington State Healthcare Authority to identify areas of common ground and consensus and to develop recommendations for state policies related to cannabis concentration and mitigating detrimental health impacts. And as a result of that work, she, among others, issued a report to the Washington State Legislature that was published in December of 2022, just a few months ago, with specific policy recommendations for the state. So clearly, Dr. Carlini has a ton of relevant expertise and experience when it comes to scientific evidence on THC concentration and health impacts, as well as policy recommendations. And my hope is that she will be able to provide us with guidance from her experience of Washington to California. And my hope is she'll help us develop a good understanding of the current state of the evidence and potentially help us draft a set of regulatory recommendations. So I've asked Dr. Carlini to provide us with a review of the current evidence on THC concentration and health impacts of high potency cannabis products, as well as a discussion of the regulatory tools that states should be considering to help limit the negative health impacts of high potency cannabis products, And I also asked her to summarize her experience leading the Washington State Prevention Research Subcommittee, and kind of the recommendations that came out of that group and which of those are actually being pursued in Washington State now, so we can learn from Washington State. And I've also asked her to make any offer any recommendations she has for California. Now, is Dr. Carlini on the call yet? Because I think we were expecting there to be more public comments. So she may not be on yet. Is that right?
Yes, she and I did a dry run this morning early, and I know that she was working on a couple things. So I think she should be here. We have one shortly. We have one of two choices. We can either go to a short break, or we can, if Katie Hess is available and ready, we can jump to her first. I'm not sure what you'd like to do, Chair.
Okay. Katie Hess, are you available and ready?
Yeah, I am. If that works for
Okay.
everyone.
Okay, so why don't we shift? So there are two presentations today, and so we'll shift the order of them and have Katie Hess from the California Department of Public Health go first. And so let me skip forward to
I've got it.
information on this talk. So Catherine Hess is with the California Department of Public Health. She's a research scientist in substance abuse, substance and addiction prevention branch. And she is the cannabis lead in the epidemiology and evaluation unit. And she has been with CDPH since 2017 and with the substance and addiction prevention branch since its inception in 2020. And I believe that Dr. Hess will be speaking to us today about the California Department of Public Health's working group meeting that happened in December regarding THC concentration, and perhaps other work that CDPH is doing around this issue. So thank you so much, Dr. Hess, for speaking with us today. You can take it away.
Thank you. Good morning to the subcommittee members. It's a pleasure to be here. Thank you for inviting CDPH to share the process and findings behind our high potency THC kind of think tank that we held in December. And thank you for the opportunity to answer questions and get hopefully feedback from some of these subcommittee members. Next slide. Go. So I'd like to start by giving you some background and context on about who we are and what we do. At SAPB, that's the Substance and Addiction Prevention Branch, our cannabis work falls under the umbrella of the Youth Cannabis Prevention Initiative. So this initiative has two complementary components. The first is the California Cannabis Surveillance System, which includes all of our public health data collection and analysis activities like tracking cannabis use prevalence, poisonings, hospital emergency department visits, and so forth. And the second component is our cannabis education and youth prevention program. And this includes youth-centered prevention and education activities like our media campaign and support for community cannabis prevention efforts. Just to provide a little context about how we're funded, on the left is a very simplified diagram of our funding structure. So we receive money from the AUMA cannabis tax, which funds the Youth Education Prevention Early Intervention and Treatment Fund, which is administered through Department of Healthcare Services, which in turn funds SAPB to administer the Youth Cannabis Prevention Initiative. And next slide. So the goals of the initiative are primarily youth-centered. Our goals are to prevent and reduce youth cannabis use and encourage youth to delay cannabis use and initiation until adulthood, to educate the public about the potential harms of adolescent cannabis use through messaging based on current science, to address and reduce cannabis-related health inequities, and to empower youth, parents, communities to reduce cannabis-related harms, whether that's physical, mental, social, environmental, at the personal and community level. And to the right here, you can see an example of one of our ad campaigns. This is called Mind Over Marijuana. This campaign is currently live and is receiving a high level of youth engagement. The campaign's aim is to provide teens with up-to-date factual information about the potential for cannabis to impact their health and well-being without any hyperbole or lectures, and to empower them to make informed choices about cannabis use. Which brings us to high potency THC, and why it's an important issue for CDPH and the Youth Prevention Initiative. So we know that use of high potency THC may carry greater risks for adverse events than use of lower potency products, particularly among adolescents. Add to that the rapid pace of emerging cannabis products, which makes public health surveillance much more difficult, and it prevents challenges when communicating cannabis-related risks to the public. Adding further to that is the fact that research on high potency cannabis is just beginning to emerge, and there are many gaps in both our understanding of high potency THC and in the actual type of research that we need to be doing. So it's clear to us that making sense of the impact of high potency THC on public health is very complex and requires a multidisciplinary approach. Next slide, please. So there's also growing concern among public health organizations such as the CDC and SAMHSA and NIDA, who have identified increasing concentrations of THC in cannabis as a potential public health issue that absolutely must be studied and addressed. So to begin to address these concerns, in late 2022, in December actually, CDPH convened a think tank of cannabis experts from a breadth of disciplines, including public health, epidemiology, neurology, behavioral economics, psychology, public policy, and adolescent health. And I'm sure I've missed a few because it was a very diverse group. So CDPH reached out to about 15 academic cannabis researchers and thought leaders in California, Washington, and Colorado. We invited members with established expertise in cannabis research or policy with the aim of bringing together scientific members to engage in conversation about high potency THC. And this think tank is really part of a broader process of continuous information gathering that CDPH is conducting on cannabis use trends, emerging products, and potential public health impacts. Next slide. So our December think tank meeting had a number of specific goals. The first was for CDPH to identify and engage with cannabis experts across a breadth of disciplines. Subsequent goals included presenting the think tank concept to potential members and also to gauge their interest in serving in a more ongoing role with CDPH. Creating and maintaining a think tank structure that was flexible in terms of membership, time commitment, and subject matter, so that in order to meet the evolving needs sort of CDPH. Learning about new and emerging issues around high potency THC and other emerging products like Delta-8 THC that may become important concerns to us in the future. And eliciting scientific guidance and recommendations on the research, health effects, and social impacts of high potency THC and potential policy actions. Next slide. So our discussion in our December meeting was really broad in scope and touched on a number of important topics, which has given CDPH a lot to consider. However, the main topics were centered on policy. We asked think tank participants to discuss what they believe to be effective policy approaches to limit the health and social related impacts of high potency THC use. And that included whether or which policy approaches have been effective in other states or countries, which policy approaches might be feasible for implementation in California, and whether, given the current state of knowledge on the impact of high potency THC on health, there is sufficient evidence in support of implementing specific policies in the near future. Next slide. So there were a number of findings from the meeting that were very helpful to CDPH in terms of how we consider moving forward. Many of these relate to the number of challenges to understanding the impact of high potency THC on public health. Among these is that the direction of high potency THC research and what evidence will be most useful needs to be very carefully thought out. Another issue is that the lag in scientific literature between when a study occurs and when it's published leads to research being less relevant over time as products and markets evolve, and that this drop in relevancy can occur quickly as new products and trends emerge. And additionally, we don't have a clear understanding among adolescents in particular about how these products are used. Youth surveys aren't exploring the modalities that youth are using to use cannabis, nor the potential potency of the products that they're using. Next slide. The think tank also highlighted that there are several cautions and considerations to account for when studying a policy approach to high potency THC. Firstly, we need to be clear about impact. Any discussion about harms, benefits, and solutions to high potency THC issues need to be clear in the type of impacts we're aiming to affect, like long versus short term, type of exposure, and the population that we want to affect or protect. Second, when exploring potential policy and policy frameworks, caution should be used when comparing cannabis to tobacco and alcohol. Although perhaps similar, they're very different substances and they are not used in the same ways as alcohol and tobacco. Thirdly, different policies may be needed for different products or populations. For example, a fiscal approach might be appropriate for one product, but a limit on sales may be appropriate for other products. And this ties in with another important consideration, and that is that potential policy solutions should be considered in combination with others. A one policy approach or a one size fits all policy should not be thought of as the only solution to limiting the potential health impacts of high potency THC products. Next slide. So in our meeting, we discussed a number of policies or policy options that may reduce the negative effects of high potency THC on public health. Primarily, these included taxation, so taxing products by THC content, purchase limits, limiting the total amount of THC that can be purchased in a single transaction or within a single time frame, for example, per month or per week. Potency or THC concentration caps. So placing an upper limit on THC concentration in different products. Age gating, which is limiting the purchase of high potency products to, say, adults 25 or older. Dosing, requiring products to be sold in specific doses with dose limits, such as 5 or 10 milligrams. And labeling and marketing. And this would include front of package labels with warnings about high potency products, plain packaging requirements, and marketing restrictions. And these are all policy options that are aligned with similar efforts undertaken in other states and countries and are part of sort of the larger menu of potential options for consideration in California. So in summary, kind of the December think tank resulted in a number of key takeaways for CDPH as we move forward. The meeting was highly useful for CDPH as we gain a better understanding of the potential impacts of THC products on public health and get a sense of what kinds of information we need to make evidence-based decisions. It also highlighted the breadth of policies that are possible or already implemented elsewhere. Circling back to our original goals, CDPH learned that there's great interest on behalf of our think tank participants to engage further with CDPH on this issue. And lastly, the meeting marked really just this jumping off point for CDPH in terms of developing an ongoing advisory structure and helped us better focus resources with regards to high potency THC issues. Next slide. So there are some more specific next steps that CDPH will be taking in the near future that has come out of the December think tank meeting. We will be working in conjunction with Department of Cannabis Control, and we'll be considering a range of policy options for reducing the potential for negative impacts to public health caused by high potency THC products. So this will entail identifying the most promising policy options among the broader menu of total options. And once some of these promising policies have been identified, CDPH will continue to work with our partners at DCC to study and gather information by inviting expert speakers to present the policies, such as their strengths and weaknesses, and different topics around these policies to the wider think tank membership and facilitate conversation about whether these options are feasible and appropriate for California. And we expect this new phase of the think tank to occur sometime within the next 6 months. And that's about it. I do want to thank the subcommittee for their time and attention. And I'd really like to take this opportunity to ask whether members in attendance have any feedback on additional potential next steps for CDPH in terms of further development of the think tank in general, or high potency THC, or emerging topics of importance to public health. We appreciate the subcommittee's kind of collective expertise, and we're eager to hear your thoughts. I'm also happy to answer any questions.
Thank you, Dr. Hess. This was a really excellent and helpful presentation. I think gives us all a much better understanding of what CDPH has been up to and how it relates to this really important topic in the area of cannabis regulation and public safety and health. So we're really grateful to hear about this important work. I'm going to open up the floor to our members at this time for committee members to ask you questions and provide comments. I would like to kick it off and start with a few. So in 2020, the previous iteration of this Cannabis Advisory Committee passed a motion calling on DCC to convene a panel of experts to review the evidence on high potency cannabis and to develop a set of policy recommendations. And so I wanted to understand whether the work that has been done and the convening of the think tank that happened in December was the result of that motion, was kind of the actualization of that motion, or it was a completely independent effort, and how you see the work that this subcommittee and the group work of the Cannabis Advisory Committee, how it dovetails with the work that CDPH is doing. What is your perspective on that?
Well, as for the sort of 2020 work group that you're talking about, that actually predates the existence of the cannabis program at CDPH. So I can't speak to whether or not that influenced our leadership to sort of bring about this think tank. I know that this is a very important topic to leadership. And in terms of how our efforts dovetail with DCC, I think we view DCC as real partners in this. And I don't think that we want to duplicate efforts, but rather sort of work together. And I think that's where we're heading in our next steps, is really more working with DCC as a partner to start exploring policy options and solutions to high potency THC.
Great, thank you. Subcommittee members, are there any questions or comments that you have?
Yeah, this is Member Woolsey. I do have a question. When you talk, and I may have missed it, but when you talk about high potency, what's the threshold for something to be considered high potency? And is there consensus in both the medical community and policies that you've seen in other states?
That's a great question, because to my knowledge, no, there isn't consensus about what constitutes high potency THC. And I'm sure Dr. Carlini could speak to this perhaps better than I could, but it's a complicated issue, and it entails a lot of things like THC to CBD ratios and different product types. So to my awareness, there is not, like, within the literature, a widely understood definition of, or a threshold by which something is considered high potency. But I would certainly Dr. Carlini on that.
Sure. And in the studies that you've talked about with teens and whatnot, what is the CDPH considering high potency? If there's no consensus everywhere else, at least what are you considering?
I don't think that we've reached any consensus within CDPH about what we would consider high potency at this time. I think that's part of this sort of think tank and these advisory sort of bodies, is to help us sort of conceptualize what CDPH would like to do in terms of like setting a potency threshold.
Right. Okay. Thank you.
This is Member Tupi. I just wanted to thank you for the presentation and look forward to seeing what your team puts together in the future.
Thank you.
I have one more question. I'm interested in how the work that that will continue to come out of this think tank work and the recommendations that you hope to ultimately provide, how it intersects with hemp-derived products and Delta-8 THC products. Will recommendations related to those products be part of kind of the scientific review and policy recommendations that you plan to come out of the work group in the next 6 months?
That's a good question. Unfortunately, not being a part of CDPH leadership, I don't think that I can adequately answer that. Those sorts of emerging products are of great interest to us, obviously, since they have a big impact on public health. But whether or not they will be a part of this specific think tank, that would be more of a question for our leadership. Certainly, we plan to pick the brains of our think tank members about some of these products, and we have kind of purposefully left the sort of ongoing structure of this to be flexible, so that if an important emerging topic like Delta 8 THC or something comes up, we can kind of pivot and still rely on sort of the expertise of some of our think tank members to guide us.
And is the goal to ultimately provide recommendations for kind of statutory policy changes or regulatory changes or both?
I don't believe that has been determined yet.
Okay. Thank you. Mm-hmm. All right. And do we have any other questions or comments from subcommittee members? Okay, seeing no more questions from the subcommittee, I would like to again offer my great thanks to the Department of Cannabis Control and to Dr. Hess for her willingness to share her time and expertise with the members of this subcommittee. And so now I want to see if Dr. Carlini is on at this point, and if we could shift to her presentation.
Yes, I'm here.
Do we need to hold public comment on Dr. Hess's talk first? DCC?
Yes, we do.
Okay. Okay. So, so moderator, I'd like to open up for public comment on Dr. Hess's talk, and then we'll shift to Dr. Carlini's talk. Dr. Carlini, thank you so much for joining us. We'll be with you shortly.
Perfect. Committee members and members of the public, we had a technical issue on the raise hand feature on WebEx this morning. We will go back to agenda item number 2. That is the agenda item for items not on the agenda once we have completed our presentations for today. So hang on, we will have the opportunity to do that. We apologize for that technical issue, but we are now going to take public comment on agenda item number 4. So we're going to be a little flexible today. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. You'll have 2 minutes to speak with a 30-second warning. And when your time is up, you'll be muted and we will move on to the next request for comment. Each member of the public will have 1 opportunity to speak on each agenda item. And with that, we will open it up. Dr. Sherry Afai, I have sent you a request to unmute. There you go.
I am a medical physician, an MD that writes and works with patients with cannabis. Notably, my patient population is under 10 and over 60. Those are the vast majority of my patients. So when we talk about policy approaches about taxing THC with max dosages or by dose-related THC content, you have to understand that this is going to be impacting the most vulnerable patients out there, pediatrics and seniors, people who do not have an income. So it's really utterly important that we take into consideration and divide up when we talk about medical versus recreational use, especially in a time when we know that medical use is drastically different from recreational use. That being said, I'm also seeing potency issues pop up in the illegal marketplace, which was not really discussed. So no matter what your policies are, which we have good policies in place, they are just not being actually enforced. I had a teenager show up with a 60 milligram gummy saying that this is what I purchased, and so therefore it must be good. This is the problem. The problem is not necessarily the details of, do we need a tax higher for a 60 milligram gummy? No, that should not be available at all in the legal marketplace. And I really would encourage you to rethink enforcement of current policies, not just how to make more policies and more hindrances to the legal marketplace. When we talk about things like Delta 8 and hemp products, it is also important to be a part of this conversation. We cannot these really potent, persistent issues that are ongoing in the surrounding areas. Thank you so very much.
Thank you. 6 asterisks. I have sent you a request to unmute. There you go.
And I couldn't agree with Dr. Yafai more. That's exactly what I was about to say. There's a big difference between the medical and recreational. The people that need the medical the most, which would require, in many cases, higher dosages. Taxation on that is just wrong-headed, in my opinion. Also, to try to create policy and recommendations for policy when you don't even have a definition of what the high THC is interesting to me. Also, the biggest difference between medical and recreational and what is high potency, that it needs to be a differentiation between the two, because one is a requirement and the other would be more of a preference. Please consider more than just the negative aspects of potentials if someone were to ingest high dosages as opposed to people that may require that. And as far as taxation or putting further barriers on people that would require it, just take all those things into consideration when you're reconvening your think tank. Thank you very much.
Thank you. Karen Woodson, I've sent you a request to unmute. Karen Woodson. Karen Woodson, I've sent you a request to unmute. All right, we'll move on. Judy Strang, I've sent you a request to unmute. There you go.
Thank you for this opportunity. I've been raising my hand since the very beginning when you were taking public comments. So I'm glad to know that technology is the problem and not me. Judy Strang with Coastal Communities PTA, where I'm the Ledge VP. It's an issue that we're discussing today that means a great deal to the parents of California. And I've much appreciated the presentation we just received. I'd like to respectfully suggest that within the scientific community, there is some consensus regarding what high potency levels could be. And I would recommend to this group to consider presentations by Dr. Ramit Lev. She works in emergency medicine in the county of San Diego. Or Bertha Madras, who is a researcher and professor at Harvard, well known for her research on marijuana. Or within our own CDPH department, within the tobacco researchers, there's an extraordinary amount of data being collected by researchers regarding the dangers and problems associated with high potency products, not the least of which is retired Professor Stan Glantz, but there are many others. We attend nearly weekly webinars the parent community does regarding the research that's coming out of the tobacco research world that has now moved over to
30
take a look at
seconds.
marijuana. Thank you. I just thought that there are some wonderful people who might answer some of these questions that you have about potency. And I just wanted to say, as a person who's assessed marijuana storefronts, you don't see anything there but high potency products. You do not see anything that is lower that we used to see 8 years ago when we first started permitting. So thank you for letting me share.
Thank you. Karen Woodson, let's try again.
Yes, thank you.
There
I
you are.
appreciate that.
Perfect.
Good afternoon or morning, members of the committee. My name is Karen Woodson. I'm the Director of Licensing and Compliance with Kiva and Kiva Confections. Thank you, Katie, for your presentation this morning. One of your first slides highlighted how the program receives funding, notably via the AUMA tax funds. And I'm curious, not only from Katie, but for the committee as a whole, curious about what happens to this programming as the industry revenues continue to fall, and particularly noting that the May revise the governor just put out indicates that AUMA tax dollars have fallen well below the $650 million baseline established last year. And I'm really just curious about what happens to this programming if the funding ceases to exist. And then secondly, I'd really like to echo Dr. Sherry Yaffe's comments about enforcement. There is a shockingly lack of enforcement, and I'd really encourage the think tank to not only examine future policies, but current policies and whether the enforcement of those policies is part of the reason you're having this ongoing discussion in the first place. I absolutely agree that alarms are necessary, but more alarms don't make us safer. We actually need the physical presence of enforcement to make that happen. Thank you.
Thank you. Ellen Comp, I've sent you a request to unmute.
So I'm Ellen Comp. I've been working for 30 years with California Normal, which is an organization that advocates for consumer rights and safety around cannabis. Echoing what's been said about enforcement, we've been particularly concerned lately about the rise of the hemp-derived psychoactive products like Delta-8 THC, which we are told are available in online and at gas stations and all kinds of places that may not necessarily card for underage use, unlike, licensed establishments that do. So I'm wondering specifically if there's coordination with CDPH and the whoever's in charge of enforcing the laws that have passed about industrial hemp. There's a new industrial hemp branch which should be enforcing AB 45, which does have THC content restrictions for manufactured hemp products. However, we are told that they are available. So yes, enforcement is an issue. Driving people back to the black market or the illicit market, more properly said, by enacting further restrictions on the regulated market, which is already suffering, tax-wise and elsewhere from intense regulations, is not necessarily the answer, unlike public education. And actually, some of the mind over marijuana ads are reasonable, I think. So congratulations on that. I'm sorry, were you just telling me I have a limited time or something? But we would love to be involved in these conversations. We've been shut out of them. We've started of your think tank. We've started our own group with Dr. Yafai and others to discuss some of these issues, and would love.
Kelly McCormick, I've just sent you a request to unmute.
And I work in a community coalition. And I would just like to say it was very telling to find out that the California Department of Public Health did not get involved in this issue until after the DCC was already involved. And really, the public health voice should have been at the very beginning. So that's a real issue. And I would like to echo what another caller said. There are other countries, for example, that have set high THC potency. Anything above 15% is considered high potency. And I know in San Diego County, where I live, 86% THC is the top selling product. And I've done assessments in marijuana storefronts as well, and you just don't find anything that's not high potency. And I would also like you to consider when talking about, if you were to set limits on potency, which I hope you do, there's still going to be a loophole for 18-year-olds. And I work in a youth mentor program. We have seen many 18-year-olds who get medical marijuana cards under false pretenses because, they just want to be able to buy the products. And so please keep in mind that you will still have teen access through that route. And finally, I do thank you for this work, and I do thank you for the presentation because the high THC use really does have a serious impact on teen mental health. Thank you.
Thank you. Benjamin Warner, I've just sent you a request to unmute. Go ahead.
First, want to say appreciate this conversation and having it at all. Just more of a, question and wondering how the DCC has defined THC concentration limits at all without any understanding of what high potency or low potency is. How do we define discrete servings? And again, just the limits that exist in our current text of regulations without any pre-existing definition of high potency.
Thank you. Lynn Silver, I've just sent you a request to unmute. Lynn Silver? There you go. Lynn Silver.
Can you hear me now?
Yes, there you go.
Sorry, it wasn't letting me unmute. Dr. Lynn Silver, pediatrician, Public Health Institute. First, I want to thank CDPH for convening this important initial scientific effort. 2 years ago, this committee recommended to CDPH the immediate creation of a scientific task force exempt from conflicts of interest to develop regulatory recommendations. We would like to see that effort continue and fully move forward. We strongly request that this work proceed and a set of initial recommendations for regulation be developed within 6 months to a year. For the parents of youth who experience psychotic breaks and other harms from turbocharged products, we are already too late. Rising potency represents perhaps the greatest health hazard from the emerging cannabis industry. It is also a problem in the hemp and illegal markets and needs to be addressed in all three sectors, especially in the context of rapidly rising youth mental health challenges. Many of these effects, these harms from high potency cannabis use affect young people in a relatively short period of time, including dependency and cannabis-induced psychosis. It can interfere with educational achievement and cause other harms. This has been a major lacuna in our state policy development, which has allowed the market to evolve inexorably towards greater and greater potency. DCC has not even required stocking lower potency products in retailers. We would strongly encourage CDPH to immediately make clear a prohibition on intoxicating hemp products and artificially derived cannabinoids in hemp.
30 seconds.
Like THCP are far more potent than Delta-9 and represent an immediate public health hazard. Most of these policies will require implementation and evaluation to understand their effectiveness, but we need to move forward amid some uncertainty and learn as we did with other products. But continuing to not do anything on these issues is not an option consistent with the protection of our young people. Thank you.
Thank you. Michaela Sweat, I have just sent you a request to unmute. Oh, we lost Michaela for right now. She'll be back. Sarah Armstrong. Oh, no, you're there.
Good morning. I had clicking issue there. My name is Michelle Sweat. I am a director of licensing compliance here in California, and I work with legal cannabis operators here in San Diego and across the state. I support Karen Woodson's and Ellen Comp's and others' comments regarding enforcement. In general, I would like to say that imposing additional restriction on people, cannabis operators who are already complying with the regulations will do nothing to curb the illegal market in California, including the rampant Delta 8 THC problem. Delta 8 THC is a problem now, not in the future. The DCC does not regulate intoxicating hemp. In fact, the DCC has steered away from it. And it's currently the CDPH's responsibility to regulate intoxicating hemp, but it's not clear why the CDPH has not developed stronger regulation and enforcement to curb that industrial hemp market. So I would like to encourage this panel to look to the CDPH to be more thoughtful and aggressive in how it handles intoxicating hemp. One more comment regarding emergency room visits is that
30 seconds.
The medical doctors are not collecting data on where these patients are obtaining their high potency THC. I would like to the panel to consider that these products are likely coming from the illegal market, not the legal cannabis market. The DCC already has limits on the amount of THC per package and per gummy, and
Thank you. Sarah Armstrong, I've sent you a request to unmute.
Okay, I've unmuted. Can you hear me?
We sure can.
Thank you. I am Sarah Armstrong. I represent the interests of Americans for Safe Access in Los Angeles and Ventura counties. Founded in 2002, we are the nation's oldest, largest advocacy organization for patients. We supported having a limited amount of high potency products in the marketplace. It was our intention that the sick and dying would have access to these products, not children, and certainly not children bent on the kind of use that's going to land them in a doctor's office. However, as you move forward, we would hope that you would consider the needs of all people and try and craft a way for those who are very ill to have access to what they need without these products falling into the hands of children. I know it's a tough ask. I know it's problematic on a number of levels, but I hope that all involved, both in the task force and at CDPH, will keep in mind that people who are very, very ill need the therapeutic relief of cannabis. Secondly, my research has shown that it is the illegal market where children end up, minors end up. And the reason for that is sticker shock in regulated markets. It's very, very expensive, and
30 seconds.
Illegals advertise with no restrictions and in places where kids can easily find them, including the internet. I hope that you will place a high priority on investigating the illegal market and how it works so that you can better understand how to keep children out of that market. Thank you for your time.
Thank you. Maggie Phillipsborn, I've sent you a request to unmute. You're on.
Okay. My name is Maggie Phillipsborn. I am the Director of Membership and Education here at the Nevada Cannabis Alliance, and we are also members of Origin School. We have a first sort of historic local that has worked with terminally ill children primarily. And I just want to reiterate the negative impacts of creating THC taxes for limits on those who critically need cannabis medicine. And that there, and I strongly encourage this committee to look into actually defining what the parameters of what you are talking about are. And I want to reiterate everything that has been said regarding some slew of unknown compounds that are being derived from hemp that are very unknown and cause some of these high potency creations that are on the market that are not part of the regulated cannabis market. So thank you for having this conversation, and please, I highly encourage you to take into consideration these great comments that have been made today.
Thank you. Tiffany Devitt, I've just sent you a request to unmute. You are unmuted. Go ahead. Ooh. All right. Tiffany just dropped off. Pamela Epstein, I've just sent you a request to unmute. Pamela Epstein? All right, we will move to Daryl Garinger. I've sent you a request to unmute.
I'm the director of California Normal, again, for consumers of California. I would like to make one point about this whole high potency issue is to some extent a red herring, because what's really at issue is overdosing, getting excessive doses, which is more likely with some high potency products, but not with all. Because if you have a high potency product and take a small amount of it, you can actually avoid problems of smoke inhalation, for example. So there are some products that can go either way, like a 90% THC potency extract, if dabbed, can give you an overpowering dose. But you take the same and you put it in a good vape cartridge and you'll get an extremely moderate dosage from this same high potency product. So do take the delivery systems into account in your, and secondly, I would like to reiterate what other people have said about the dangers of these hemp products with psychoactive cannabinoids, many of which have never been tested for safety before. These are all illegal in California under AB 45, which was passed last year, but there's been no enforcement. I saw a product that was in blatant disregard of
30 seconds
of AB 45 and tried to report it. And I went to the CDPH website and there was not even a place to report a violation. So I think there really needs to be some better enforcement on the against the illegal hemp products. Thank you.
Thank you. Becky Rapp, I've sent you a request to unmute.
Rapp. I'm a parent and a public health educator down in San Diego County. And I too am deeply concerned with the high potency Delta 8 products that are being sold. The DEA issued a letter stating that these Delta 8 and Delta 9 THC synthetically derived from hemp will not qualify as hemp, but be viewed as a Schedule I drug. So, but we are currently seeing these Delta 8 and Delta 9 THC products being sold across our county. They're sold in conventional retail locations such as gas stations and convenience stores, and local smoke shops are openly advertising these products with flags stuck in the grass of shopping center entrances and colorful signage in the windows. So I guess I'm asking, what kind of enforcement can we expect to see in the future? And how soon will these products be removed from the shelves? Thank you.
Thank you. Pamela Epstein, I've sent you a request to unmute. Pamela Epstein? There you go.
Can you hear me?
We sure can.
Sure. Wonderful. Thank you so much. Sorry for the confusion. My name is Pamela Epstein. I am the Chief Legal and Regulatory Officer for Eden and the President of the California Cannabis Industry Association. I would like to express and share with many of the other commenters. This issue is complex and we need to look at it from the intoxicating hemp cannabinoid space. There are no regulations or limits there. Those products exceed the max potencies within the regulated supply chain. This is an effort that requires both of the two E's, education to the consumer and enforcement into the agency. It requires the Department of Cannabis Control to actively enforce their existing regulations. The failure of the department is not the failure of the industry. The industry has shown there are 100% compliance in checking of IDs. The industry is very much committed to ensuring that consumers have the necessary tools, safe stash, safe consumption, education. We are committed to that. And this issue needs to be addressed from a higher level. Cannabinoids affect the body the same way. They do not know where they are sourced from when they are consumed by the consumer. So this is an effort that needs to go well beyond the regulated industry, as the regulated industry is where products are safe. Outside of it is an unknown, and it's an unknown from e-commerce all the way through the stores that are popping up in proliferation exceeding those of the regulated market. So we invite that conversation and hope to continue to educate from a holistic point of view. Thank you very much.
Thank you. Roger Morgan, I've sent you a request to unmute. Go ahead, sir.
I'd like to retire, but a couple of things I want to point out. Number one, marijuana was harmful even when the THC content was 2%. It's harmful to humans, but of great importance today, which is overlooked, is that people who use cannabis are a threat to public health and safety. This is a 1-year anniversary of Uvalde. I want to say that in my research and others that I work with, that every mass shooting in this country, with rare exception, maybe Sandy Hook and University of Virginia long ago, but every one of them has been the result of somebody suffering from marijuana-induced psychosis. So the impact on 15% of the people who consume cannabis are a major threat to others. I don't think that there's a solution to this other than to go back to prohibition, which is probably never going to happen. But I am strongly of the opinion, as well as the last speaker, that we need an educational program, not just in California, but since we export about 60% of the products used in the United States, I think the California government should step up, quit giving all the money to cannabis growers and others, and support a educational program, and we can help with that with best experts in America. Thank you very much.
Thank you. All right, last call for public comment on agenda item number 4. I see one more. Tiffany Devitt, I've sent you a request to unmute.
Can you hear me?
You sure can. Nope, now you've dropped off. All right, at this time, we're going to close public comment for agenda item number 4. Since I see no further requests, I will turn it back over to you, Chair.
Thank you, moderator. Seeing no more public comments, the agenda item number 4 is now closed. And we will move back to agenda item number 3 to receive a presentation from Dr. Beatrice Carlini. Thank you very much for your patience. I already gave you an extensive bio before you joined, and so hopefully folks know a little bit about who you are now. But just to remind everyone, Dr. Carlini has extensive experience and expertise in the area of high potency THC cannabis products, both studying them from a scientific perspective as well as developing policy recommendations for the state of Washington. And we are grateful to learn from her today. And with that, Dr. Carlini, you can take it away.
First of all, I want to thank you all for the opportunity to be here, and particularly to Dr. Matei for the kind invitation. And what we are going to try to do today is, so first of all, let me define a little bit things that were, that were deferred to me. So in terms of the definition of what is high potency or high concentration THC products. In Washington State, we have been using the definition to make the cut point towards around 30 to 35%. And I say 30 to 35%, there is a little difference between people, but basically what it defines is if the product is the plant itself that is being used, or if it is a manufactured product or a product that were processed and made into a different product that doesn't look like the plant anymore. So these manufactured products have been the center of our attention when we discuss high potency products, and to be the ones that we are really concerned in terms of their health consequences. When we say high potency, we want to also define as high concentration of THC. We know cannabis is a complex plant, but that's what we are referring to when we look at science and when we look at also policy options. Further ado, so here, let me see where, okay. So I'm going to concentrate my talks today in 4 main blocks, starting with cannabis concentration and legalization. So there's a lot of this idea that cannabis became so concentrated after legalization, which is true in some way, but I want to position this a little more. And yes, I'm going to go back to this slide because I want to reiterate over and over and over that all our work it's about non-medical use of cannabis. Our policies recommended by the legislature are only specifically for cannabis that are used outside medicinal purposes. We agree with the 2 testimonies of 2 physicians, I believe, that talked before us in the comment session, bringing the topic that patients may have different needs. We don't want to give legislative policies and suggestions of what is between the clinician and their patients. So just to make this very clear, so don't get this in the middle. Okay, so in terms of cannabis legalization and concentration. So we all recognize, and I think this has been well documented, that cannabis, the THC concentration of cannabis has been going up and up and up since the 90s. And this is in big part related to advance on agronomics and techniques of planting, particularly the synsemia techniques of making the plant able to produce more and more THC. We do see that now, the last data in 2019 of DAC's plant material show around 14%, which is, tripled since 1993. So when we think about high potency, potency and the things I'm going to present today, we are really talking about manufactured products. So people, legalization, yes, brought the mass production. They didn't invent, but did bring the mass production of getting the plant and adding, extracting, concentrating, purifying, processing the plant to become actually something else, to not resemble the plant that we voted to legalize in most states. It's almost like the plant, it's like comparing strawberries with cupcakes that are made of strawberries. They are so far departed from the original plant, the fruit, that they really should not be considered the same thing. And that's what we are seeing. So in Washington State, these manufactured products, all in the, it's not included here, the Delta 8 produced products. They are, already 30% of 35% of the market back in 2020. They were 9% when legalization, the first store opened. These products contain between 6 to 90%. They can be dabbed in dab pens or in dab rigs. They can be mixture for inedibles, and they can also, what is becoming increasingly popular, in pre-roll joints sold in stores. They can be a joint, the plant added with these highly potent products. So yeah, so these products are around. They became very pervasive since legalization, 35% of the market share in Washington. And we should ask, what about these new products? Is high potency cannabis more detrimental to health than lower potency? And if they are, do they affect marginalized and vulnerable populations disproportionately when compared to traditional lower cannabis potency cannabis? These questions are important because in great part, we see researchers looking for an answer on research that has been produced before the mass production of these products. And we can wait 10 years until we have maybe tentative responses if you are waiting to have research done in this product. We in Washington adopted a different approach. And this approach is, let's look at the literature and see what we can find between dose of THC and harms. Is there a dose response relationship? If you have more THC, do you have more harm or not? And we do believe this is a very accurate, scientific accurate way of assessing the harms of these highly potent products. In 2019, we put together a workforce, a work group, was a joint, and joint is a strange word to use in this context, a joint initiative between University of Washington and Washington State University. We work under a state prevention research subcommittee that is funded by a healthcare authority. And this work group I had the honor to chair, and we produced a report that is meant for lay consumption. It has embedded in science, has a lot of reference, but have a easier to digest language. And the full report, the cover is there in the right, and the full report is available online, widely available. I'm going to present some highlights and spare you of too many scientific details. This can be, we are going to get the scientific results, but not a methodology as much today. So the first question was this, right? Is high potency cannabis more detrimental to health than lower potency cannabis? And there's a group of 11 Washington scientists we worked 6 months of looking at the data, made the conclusion that yes, it is more detrimental to health. So the first thing is we looked at what is already available. Cannabis concentration calls to the poison center. This is national data, was reviewed by one of the members, Dr. Julia Delay. And what she looked was is like, let's see nationally who are calling the poison center referring to cannabis. And let's compare those that call with concerns about having ingesting or consumed the plant versus the ones that are called with manufactured products, meaning concentrate, vapes, or edibles. And that's what she found. So as you can see, let's look at the picture here on the right. You can see that plant materials are by far why people call. It's the most of the calls are plant materials. And you say, well, so it doesn't seem like manufacturer high potency are making such an important thing. You can see they are added since 2017, but still plant is the most. What is interesting though is to see, if you look on the left, although plant materials are the most, calls are about plant materials or the plant, the cannabis plant, the majority of them people call because they have used cannabis plus something else. They have used cannabis and alcohol. They have used cannabis plus heroin. They have used cannabis plus methamphetamine. So in that sense, cannabis is involved, but are most likely not the reason people called. They were not calling because they had smoked cannabis. Very different if you look in the bottom here of the left material, the left side. If they had used concentrate edibles or vape, 82% of them called because they just had used that and they were stressed, they were in distress, they were in need of help because they had used these products. More importantly, or equally importantly, about 30% of these calls were related to children 11 or younger. So you can see there is some indication that these products do bring acute events that are more related to only the cannabis plant and have been added to the already calls that had involved the plant. What about another more long-term than negative consequence? So cannabis causes a lot of other mind-altering substances can some people develop cannabis use disorder. And here are some of the, are the main symptoms of it. They basically use more than they would like to use. They have difficulty controlling and cutting down. They're using larger amounts than needed, spend a lot of time just on cannabis use or purchasing cannabis or finding cannabis or using cannabis, and it stops doing other activities that they enjoyed in the past. So there are also good studies that was reviewed by Denise Walker, and is a small but important body of research that is going this direction. And I'm one study, for instance, was Curran that they tracked THC potency in cannabis use disorders when they started. So they found basically that people that are experiencing symptoms of cannabis disorder, they have 4 more times chances to be the ones that were consuming higher potency cannabis as compared to those not endorsing symptoms onset. So disproportionately, the people that use cannabis of high potency, they have been feeling already symptoms of cannabis use disorder. Barrett et al. Found that among youth experimenting with cannabis concentrate use increase the risk of progression and persistence of use during a 12-month period more than other cannabis products. So in 12 months, it's way higher to become dependent or have symptoms of cannabis disorders if you are using higher potency. So the conclusion on this section by one of our scientists was the use of cannabis with high THC concentration increases the chancing of developing cannabis disorder or addiction to cannabis, particularly among young people. What about cannabis concentration and psychotic disorders? This is a kind of topic that when we mention, there is a lot of, tendency of people of stereotype this as reefer madness. It's like, oh, now we are going back to this. But the research is there, science is there. When we say psychotic disorders, most time we are talking about schizophrenia or other disorders too that cause abnormal thinking and perception. The main symptoms are delusions and hallucinations. Reviewed by Dr. Michael McDonald. And I'm going to present one study that is a seminal study that's going to show very clearly what we've been finding also in other studies. So this was done, I think is important to mention, in 11 different cities around the world, which means that it really increases the validation and the generalizability of the findings. We are showing 3 cities here. And in these 3 cities, the little blue bar is people that never use cannabis. And then increasingly, they use cannabis more often and of stronger potency. When you get to the green, you're going to see that these people used daily high potency cannabis. And what we are seeing here is that compared to people that have not used cannabis, having a first episode psychosis is more likely, 5 times more likely, and if you have used daily high potency cannabis. The same 9.4 times in Amsterdam, 4.28 in Paris. If you are using, you are way more likely to have a first episode of psychosis, psychotic episode that meant that you need to go for help. Looking at the literature, there are way more in our report. The main takeaway was that daily cannabis use, particularly for high potency products, increase the risk of developing a psychotic disorder like schizophrenia. Also important and not pictured in that graph, the daily use of cannabis, particularly high potency, is associated with increased symptoms of psychosis in people who already have a psychotic disorder. So the people have already, and if they use cannabis or continue to use cannabis, they have way more higher rates of hospitalization and way more symptoms than people that otherwise have psychotic disorder but not using cannabis. The other question that I showed in the beginning there is, okay, well, are vulnerable and marginalized populations disproportionately affected by high potency cannabis use? I think we all care about equity and disparity here. And looking at the data we had so far is yes, they are. To respond to this question, we looked at data analyzed by Dr. Kathleen Firth, and she looked at CDC data, the Washington, in case this is nationally available, the behavior risk factor surveillance system. And what she sees here, she used DAB because dabbing, you are dabbing manufactured high potency products by definition in the past 30 days. And she found that people of historically marginalized communities, in this case Latinx, people that have lower level education, make less money, have no health insurance, and people that report themselves describe as having poor mental health are way more likely to have been using dabbing as other populations or subgroups. So after working for 6 months, our group of scientists not only produced this report, but also signed a consensus statements that we shared with legislators and public health agencies and state agencies in general, concluding that the greater the potency of cannabis products, the greater the likelihood of adverse health effects. So not necessarily all the science has research, particularly on dabbing and particularly on these new products, but the research is very consistent that the more you have, more THC you have in products, independently of other compounds of the cannabis plant, the more likely are people to experience adverse health effects. None of this research is done with medical patients. I want to emphasize this yet again. And we are not talking about the relationship between patients and doctor for very difficult and very painful conditions that they may benefit from cannabis. Not only we got this conclusion, but also to say the increased risk imposed is particularly concerning for young users and those with certain pre-existing mental health conditions. Harms are likely to disproportionately affect historically marginalized communities like low income and minorities. Okay, so what about legislative attempts to regulate products in Washington State? Let's just begin to say, no, they are not regulated in Washington State to this point. There were 3 attempts of putting bills, 3 from the House bills, one to cap THC concentration at 10%, another 35%, and the House, another House bill this year that I'm going to talk specifically about that in a minute, that it was a big comprehensive public health package to address the issue of availability of high THC in products in Washington State, particularly the manufactured ones. In all the cases of these bills, the bill was proposed, was designated a committee, and after the hearing, it was kept hearing for all these three bills. It died right there in the floor before going to the floor. The hearing was typically, and I was part, I think, of all the hearings. There were people that were, supporting the bills, people that were against the bills. The supporting the bills mostly were people with lived experience, parents bringing situations of their kids suffering from psychosis or severe cannabis use disorder, and also scientists and physicians that had experience on seeing patients with these issues. Scientists usually present the science behind. They are not supporting or not supporting specific views. That's not what we do, but we are bringing the science that supports the rationale where the view comes from. In terms of the against the bill, mostly people, members from the cannabis industry, some medicinal patients also say things, but usually they are explained that this is not related to medicinal cannabis. Industry representatives, basically, we are performing a content analysis of their main discourse during the hearings. They minimize the research findings that some of them I just presented, criticize the research designs, like, they don't think a case control is powerful enough or things like that. They misinterpret the data. They frequently equate our proposal to regulate products with prohibition, accusing people that want to regulate going back to the dark times of prohibition, like challenging the will of the voters in the states where, in the case of Washington State, and also make potency sound more complicated than it is. That's why we're very clear when I define we are talking about the concentration of THC independent of other compounds. I'm not surprised of finding this kind. I mean, I'm a person that has been in the field for a long time. If you look at how the alcohol industry has also related to the attempt of regulation, is 95% in this study made of looking at their reaction, they misuse or deny evidence, and they make unsubstantiated claims about the adverse effect of policy. So nothing new there, but I want to point out that's what we are facing in Washington State. Last but not least, let's talk about this public health package I just mentioned that is recommendations to legislators. So ADAI, and I have the honor to work at ADAI and to direct the group that does cannabis work, received a mandate in 2021, part of the legislative legislative decision that mandated Washington Healthcare Authority to contract with us, ADAI, to write a report to Washington legislature with policy recommendations. We had a year and a half to work to explore and suggest policies in response to the public health challenges of high tetrahydrocannabinol potency cannabis. We did this work diligently looking at research evidence yet again. We updated, it was 2020. Let's look like 2 years later, what local stakeholders wanted in support. So we did, some of you may be familiar, this very interesting method is called concept mapping that gets from bottom up what are the ideas of people about what should be made about a problem. And you also look about the context in North America about other policies and initiatives, which at this point is totally out of date because things move so fast. In terms of research evidence, I want to invite you to see our resources. In 2022, just this last September, we had made this 11 scientists, a big task force in Washington. We then invited national and international experts to doing a whole day, discuss the market trends, short and long-term risk, and possible solutions to high THC cannabis in legal regulated markets. It's available too for you. It's a recorded, very well put together. It's easy to watch. It's entertaining, actually. With this work, after a year and a half, and I'm wrapping up here, we work on recommending 3 main areas of policy and encouraging to all this be adopted as a public health package. First, is discourage the use of high THC. So let's look at the bold first. Discourage use of high THC cannabis products. And the way to do that is to usually, if you look at the literature in alcohol, in tobacco, and unhealthy foods, is taxing. When you tax, and tax is pretty high in Washington State, still we have one of the cheapest cannabis in the country. If you tax not by the price, as is the case in our state, but by the content, you de-incentivize the use of these products, and you incentivize people to finding less risky options. So using cannabis as a plant, for instance. Prevent the high THC initiation. Marketing is a big driver of using products in anything. This is capitalism. So prohibiting market specific of this product without, while following the current rules of other products, other cannabis products, could discourage the initiation of these products. Increase purchase age of high THC cannabis 25. That has never been done before, but considering the very clear data that psychosis has been in many cases triggered by cannabis use, particularly high potency. And the fact that this is the time when psychosis start, we thought that was scientifically sound, and that we had some support of stakeholders for that. And last but not least, things that seem like so obvious that everybody should do. It's like, how are we not doing this yet? Is improve labeling, making labels in font size that actually people can read. They have a contrast like black and white instead of beige and darker beige, and also with clear information of dosing that people can understand. Warning labels specific to high THC cannabis, public health campaigns directed to understand the dangers of these products, and education at point of sale. So this is all. It's full of links, this PowerPoint, there for people that want to read our detail. It's like 45 pages with a lot of supplemental material to come to make these suggestions. Thank you.
Dr. Carlini, thank you so much for that talk. That was incredibly helpful. I appreciate you taking the time to get us up to speed on where the science is at and what we know, what your experience has been. I think we can all learn a lot from everything that you just said. And so I'm really grateful for you taking the time. At this point, we have the opportunity for members of our committee to ask you questions or offer comments. And so I will open the floor to do that, but I want to start with one question on my end, which is that at this point, multiple states, including Washington, have gone through the process of convening an expert group, reviewing the scientific evidence, and then making policy or regulatory recommendations to their state about what to do about high potency products. And then not very much happens based on those recommendations. But also that the recommendations don't seem to vary that much from state to state. So I'm wondering, in the case of California, is it worth continuing to convene a panel of scientific experts to develop policy recommendations for our state, or are the policy recommendations across states pretty much the same, and the scientific evidence has been reviewed up until this point? And at this point, California, there are harms happening every day related to high potency products, and should we just be moving forward with the recommendations that have been offered from other states, or do you think it's important for California to kind of convene its own working group?
Thanks for the question. It's very hard for me to say, being outside of California, if it's important or not. What I do say, though, see those have been observing is going around and around and around, nitpicking on science and like trying. I mean, I drive my life as a scientist based on the precautionary principle. I mean, if the science is showing, although not perfectly yet, that this looks like a risk for safety and public health, we should act on it. We should adapt a measure. And the people that are using, purchasing and profiting from these products have the burden of the proof that these products are safe. What we are seeing signs is they are not safe. They are risky. And although most people use cannabis relatively safely, the ones that are suffering tend to be from most vulnerable communities, most vulnerable ages. And so to be repeating over and over that there are nuances, that science is always incomplete, and it is, that's what science is, and not doing anything while we went from 9% to 35% of market share in Washington State, for instance, is not something that I recommend. But I cannot speak in behalf of what works in California and what makes sense in California. Sometimes you have to repeat some things just to make the California case. I wouldn't spend years doing that because people are suffering in the middle, but you might have to repeat something, you know, make it more specific to your state. Hope I kind of answered the question. It's a hard one.
It does. That's great. Yeah. And it's specifically, it's clear that the research so far is not perfect, right? And it never will be. And so, but it's also clear that we need to act, we need to do something more than what we're doing, right? And so are there recommendations that you have for kind of navigating and responding to industry representatives who criticize the science?
Well, I don't have a answer to that. Then just keep bringing science, and also I think what is important for scientists is to that's totally my personal opinion, is to kind of identify where are the moments to really express all the nuances that we express between colleagues about the methodology and the, you know, all science is a work in progress. And when it's time to make statements where the statements belong, that, yeah, the science is incomplete, but this is harmful. I haven't seen anything that this is beneficial or this is not harmful. The dose-response relationship is very clear. So what can I do except sounding like a broken record? You cannot imagine how many times I gave a similar talk. Like, you know, so it is complicated, but things are way more complicated. In Washington State, there is an increasing lobbying and sophistication of arguments of the industry. It's a for-profit industry, so I can understand that they're making their living.
Thank you. Other members of the committee, do you have questions for Dr. Carlini?
Yeah, this is Member Woolsey. I do have a couple of questions for you. And I want to thank you for your time and also thank Katie Hess for her time earlier. And I didn't mean to put you on the spot, Katie, with that THC question. And I appreciate that the state of Washington is using a 30 to 35% THC as a threshold for what's considered high potency. But I'm not sure how that translates into an edible product. I know when you have a concentrate like a wax or the plant, percentages is pretty easy. But if you're talking in edible products, what would be a threshold for a high potency edible product in the state of Washington? And in California, we have 10 milligrams per serving or 100 milligram per package limit on THC concentration, but I don't know how that translates into percentages. So could you explain that to me?
Yeah, it's kind of complex, and I'm not sure I will explain it the way you want it, but yeah, we do have a similar. So you can measure cannabis by concentration or percentage, but you can also measure by dose. And there is a strong movement to try to establish a universal serving size or universal dose, not only for edibles, but across all products, because that would help a person say, okay, if I'm dabbing a product, I'm, you know, how many milligrams of THC I'm ingesting, I'm putting in my body as compared to eating a a little gummy that has a 10 milligrams. So that would allow people to learn how to dose their own cannabis, although incompletely, they would learn somehow, like we do for alcohol. We know the beer has, 1 cup of beer has the same as a measurement of, a little shot of whiskey, for instance. So in case of the edibles, you do have milligrams. That does the 10 milligram is considered a dose of, which means they are not necessarily a high potency product. They are just a product that have 1 serving, and if you take many of them, you're gonna ingest a lot of THC, but doesn't mean that by having a 10 milligram, you are ingesting a high THC product. So it is not concentrated that way. It has a 1 unit. A lot of people cannot even use this 1 unit. They will have to use 5 milligram, which is the internationally suggested dose. Some people may use 2.5, but you are not ingesting per se a high THC product when you are having 10 milligrams. I realize it's an incomplete response, but that's the best I got right now.
No, that's helpful. The follow-up question that I have for that, and I don't use cannabis, so I can't really speak from experience. But I've heard if your need or desire is more than, say, 100 milligrams, you would have to eat perhaps the whole candy bar. And while that would get you to the effect that you want because you've consumed your 100 milligrams, you've also consumed perhaps 10 times more sugar in the candy that you maybe wanted to. And so is there a way to balance that concern of a high potency product and saying, well, if we limit the dosing to small doses, then you can just take more to meet your need? Well, you're consuming more other things as well. And I don't know if there's any science on that or studies that talk about that.
Yeah, that's a very important question. So the first point I would make is, the science is showing that using, let's say 100 milligrams of THC, it's really a bad idea. It's a really risky idea. So I don't think we are in the business of making that easier for people to consume. If it is for medical reason, it shouldn't have sugar to start with. They shouldn't necessarily start using cannabis as a medicine. They should resource to something else that would give this 100 milligrams if they need that amount. For other uses, for hitting some high, as a society, we may make this harder to do. Because it's we are going to pay a cost as a society of treating this person later. So I'm not particularly, concerned that a person, if she wants to get this level of intoxication exposure to cannabis, we should make products more easier to ingest for the person. I don't believe from a scientific and personal perspective that will be the case.
Right. And then I also wanted to know if you're aware of any studies that talk about trying to assess people who want high potency products, because at least in Washington, I think you said it was 35% of the market share is high potency product. So people want it. People, are interested in consuming that. And when you limit that, while that does tend to perhaps encourage people to find a lower potency solution, there are still people who are going to seek that regardless, and then that's going to drive them to the illicit market. And are there studies that show, policies that cap or limit potency products drive people to the illicit market, which is a big problem in California? I don't know how much of a problem it is in the state of Washington, but here it's people might have otherwise purchased a product in the legal market, but they can't get it, and they're going to get it regardless. So they're going to go to the illicit market, and as long as that demand is there, there's going to be a supply on the illegal side. And I'm trying to figure out a way to balance public safety from both points of view, trying to manage the public health cost later of overdosing or psychosis and the medical treatment, costs and issues that go along with that, versus the public safety of, having people go to the illicit market where products are not tested. And not that tax is a big issue, but those products are not taxed, and there are other, they're not regulated. So are there studies that talk about how much people would have bought in the legal market if that product was available, but those policies drove them to an illegal market?
Yeah, that is a very, very important question, and we hear that a lot, and it's a valid concern. Of course, I think it makes a lot of sense. There are no studies specifically on that issue because no state had the courage so far to limit this product. So if we had, we could know, and there is always the possibility to go back, right? So you have to have the courage to do what makes sense to protect people and then to roll back if it didn't work. And that's what the whole legalization was at some extent, a big experiment of a society. And there are not Americans to have the courage to try that. That's who we are. We have courage to try new things. So that's one point. I mean, how can we have? We don't have that. We did have, and I showed that slide on this very interesting one-day symposium that we did in Washington State to discuss with international scholars about possible solutions. And taxation was discussed at length, and also capping, which would be prohibiting these products at a certain level, right, after a certain level of THC. And the health economists, while knowing that there is no research particularly on that, because never happened, they also looking at other products. What they do consider is when you make a product illegal, like the whole cannabis cannabis illegal, yeah, it's gonna go to illegal market. If you do one particular product more expensive or even illegal, some people will go to the market, to the illegal market for a little while. And that's what I heard most in the comments here is the importance of enforcement. I heard that a lot today. So that could be approach with enforcement. The cannabis market share of concentrates didn't grow out of people wanting because most of them didn't even know it existed. It was the marketing and the availability in the stores that drove the increase. It's not that people wanted, was through marketing, they believed they wanted, and through price and availability, they decided to try. So if this doesn't exist, some people will not start using because they're not going to be available, they're not going to be marketed, and they would cost more. And some people may continue, but according to this health economist, and I'm citing here Jonathan Calkins from New York, and he does he does show how this would probably be a transitory problem, and if all these forecasts were wrong, we could always go back.
All right, thank you.
Yeah.
Other questions from other members of the committee?
This is Member Tupy. I wanted to thank you for your presentation. It was extremely helpful. I did have a follow-up question, specifically piggybacking on the conversation related to edible products. Were there any recommendations made as far as dosing sizes that in Washington? Was it the 10 milligram or was it a lesser number that was recommended, or was that not addressed?
We do recommend among, on the labeling part that all products would have a 10, would report of how many 10 milligrams or, serving size they had. So again, internationally, 5 milligrams, and including our National Institute of Drug Abuse suggests 5 milligrams as a dosing unit, but because in mature markets like Washington, 10 milligrams has been used for edibles for a couple of years now. We thought 10 milligrams would be an important number to become, more tangible. So we do suggest in the labeling, not only in the label, not only edibles would have the 10 milligrams, but also any other cannabis product will have how many doses of 10 milligrams you have in this package or in a certain amount. What is the size of this? What is the size of your 10 milligrams? For a dabbing must be like the point of a needle, you know, will be the 10 milligrams.
Other questions from any members of the committee? I have one more question related to health, potential health harms that may come from manufactured high potency products, not because of the high concentration of THC itself, but also because of concerns related to additives that are in the concentrates like terpenes and so forth. I'm wondering if you could speak at all to kind of summarize at all what we know about that, and any kind of policy recommendations related to that piece of it.
Yeah, no, that's an important topic too, and I've been not following too closely what the state of regulations in Washington in this domain, but I would say in general, these manufactured products do what other manufacturing processes do, particularly in food, to add things, you know. So we know terpenes are added, and terpenes, as you probably know, is, you know, it's basically what gives you the scent. And sometimes you have added terpenes that are not from the cannabis plant. So it could be from citric fruits, for instance. And we really don't have much of research what happens when you inhale the scent of orange or scent of lemon. So that is a uncharted territory that adds a added concern. The other topic too is about residues. So if you get the plant and you use butane, which is very often used to create these manufactured products, is there a way to measure that really there is zero butane that you're putting in your lungs? The other topic is if you have issues related to use of pesticides, and the pesticides were tested in the plant and were in the accepted limit. When you concentrate these products, are you concentrating pesticides and also increasing your exposure to pesticides? So these are important issues that we, my group, are not directly addressing. We are mentioning them. We are concerned about that. And it should be looked into for sure, and it should be tested and put into regulation. They are shelf-stable products, so that's very appealing. They are cheaper. They are the ketchup of the cannabis. It's like you get your old tomatoes, put all in the jar, add sugar, you name it, and put it there and last for years. And this does not come without consequences.
Thank you. Okay, one last call for any further questions or comments from members of the subcommittee. Okay, so seeing no more questions from the subcommittee, I would like to offer my sincerest thanks and the thanks of the Department of Cannabis Control to Dr. Carlini for her willingness to share her time and expertise with the members of this subcommittee. I think we all agree it was a huge help, and we're very grateful for your time.
I appreciate the invitation. Thanks so much.
You're welcome. Thank you for attending. All right, so at this point, members, we have the option to consider whether or not we would like to make any motions for recommendations. On the one hand, I think that this presentation has given us a lot to think about, and I think that we will likely want to re-agendize the topic of THC concentration and continue to talk about it over the course of multiple subcommittee meetings. At the same time, I think there are potentially some recommendations we might be able to consider now. And I'm going to propose something and we can react to and discuss it. So what I would propose is that for today, we're really focusing on adult use cannabis, not on medical. And I think it's clear that there's a lot of ongoing work happening at CDPH involving an expert panel, identifying points of consensus for California and development of policy recommendations, and that there is the intention for CDPH and DCC to work together in developing those recommendations. And that process, you know, working through a panel of experts who are qualified to understand the science and working with a group that will be able to identify kind of what there is public support for in California, that process is likely to develop kind of better policy and regulatory recommendations than we are going to come up with as a committee, a subcommittee here today. Because as far as I know, I'm the only scientific expert in this group, and a panel of experts is going to do doing work over the course of multiple months is going to do a much better job of coming up with nuanced and well-refined recommendations. So my suggestion would be that for today, we don't develop specific recommendations like we should be taxing cannabis products at this percent potency based on potency in this exact way. But my suggestion would be that we support DCC's collaboration with CDPH to create evidence-based regulatory recommendations that reduce the health and social harms associated with higher potency cannabis products. So I want to propose a motion that would say we support this and we want you to keep doing it. And then I'm also concerned that by hearing from Dr. Carlini's experience about this common phenomenon that recommendations are made and then aren't taken up. And I think we've seen in the past the same thing happen in California, that public health experts have issued recommendations and those based on good science, and those haven't been taken up. And so I would like for us to also consider whether this any motions that we make today might include some sort of recommendation that the DCC actually adopt the regulatory recommendations that come out of the task force, the think tank that CDPH described. And then the last piece of it I think we should consider is the timeliness of this work. It seems that there's great potential for this discussion to go round and round and round, and we're reviewing science and considering recommendations, and it's kind of not moving forward. The CDPH think tank was as wonderful and productive as it was. That happened in December. It's been 6 months almost, and things that haven't moved forward that much, right? So I wonder whether we should also incorporate a component in this any motion that we want that specifies a timeline and requests that this process be pursued efficiently, because there are health concerns at stake, there are people's lives at stake, and so we want this to be taken seriously and moved forward. So what I would propose as the language of a motion for us to refine and discuss, if you all amongst ourselves, is the language of the motion would be this. The CAC Public Health and Community Impact Subcommittee recommends that DCC continue to work with the California Department of Public Health to convene an expert scientific task force exempt from conflicts of interest to review the scientific literature on the issue of increasingly high THC potency of cannabis products, and to make public health recommendations to cannabis regulatory agencies and the public. We recommend that DCC adopt the regulatory recommendations provided by this task force, and we recommend that the work be completed urgently and no later within the next 12 months. So that's the motion that I'm throwing out there for us to consider, and I welcome comments and thoughts and discussion from other members of the subcommittee.
Do you need a second before we can comment on the motion, or can we comment on the motion before a second?
So at this point, I'm not saying that this is the motion. I'm not making a motion. I'm proposing a potential motion for us to refine, and then we can motion it and second it.
Okay. So to that extent, I support, I'll call it parts 1 and 3, which I think is supporting the DCC continue to collaborate, that they try to come out with something within 12 months. it's probably a goal that can be met. As to part two, that they adopt the recommendations, I would like to see the recommendations before I commit to saying that. Not that I don't have a science background, so the science would have to kind of speak for itself, but it's hard for me to support blindly what those recommendations might be, and then the consequences. I would like to, I like that you mentioned, and that the CDPH is working on something that's not, that doesn't involve conflicts of interest. But I've heard science from two experts, talking about the problems and the harms. And I just wonder if there's another side to that should be heard, so that it's not a one-sided conversation. I don't know how to accomplish that, and I think hearing from the industry is not the best place to get that other side. But is there contrary scientific literature out there that talks about concentration to some degree? And then I would add perhaps a part that because I think Katie has mentioned their funding is based on some tax revenues directly related through AUMA, but if that funding falls, I would hate to see this important work not get funded. So a recommendation that funding if it falls below a threshold, that they seek other funding sources through whether it's the legislative process, or I don't know how to do that, but I would hate to see it something not get done just because tax revenues fell.
These are great comments. Thank you so much, Member Woolsey. Other comments from other members of the subcommittee?
Member Tupy, I would kind of echo what Member Woolsey said regarding parts 1 and parts 3, being supportive of those. I a little bit the same, that I'd like to see what the recommendations are before endorsing or moving forward with them. I do like the piece of kind of making a recommendation that this move forward as a priority regardless of what the funding is, that kind of this be made a priority in funding choices. And then with respect to participation in the group, or in the members of the researchers, I guess a little bit, I'm wondering if there can be a balance where there is that industry input, yet there's no maybe direct financial stake or something along those lines to keep that that distance. And I'm not sure how to word that, but I do think that having multiple voices is probably in views is probably helpful through that process as well.
Great. These are really helpful comments, and I'm working on revising language to draft a revised version of what this motion could be that incorporates these comments. Other comments from other members of the subcommittee? I know that at our last roll call, Member Bauer was not present, but it looks like maybe she now is. So I just wanted to ask Member Bauer if you have any comments or anything else to add.
Nothing to add, but I do think I agree with the previous two members around having a little bit of clarity about what the process or recommendations would be, and then also so we're make sure that not putting undue harm on client and legal operators, but very concerned about
I think you were breaking up a little bit there, Member Bauer, but I think what I heard was you're supportive of the comments from Member Tupy and Member Woolsey, and also with in agreement with public comments that around concerns about putting additional burdens on legal operators when there's concerns. The concerns are mainly in the illegal space. Please correct me if I'm wrong.
That's accurate. Sorry, I'm driving. I apologize.
No problem. Okay, thank you. Okay. So, taking each of these comments into consideration, the revised language I would like to propose is the CAC Public Health and Community Impact Subcommittee recommends that DCC continue to work with the California Department of Public Health to convene a balanced expert scientific task force exempt from conflicts of interests, i.e. no financial interests, to review the scientific literature on the issue of increasingly high THC potency of cannabis products and to make public health recommendations to cannabis regulatory agencies and to the public. We recommend that this work be a priority for DCC regardless of funding available from CDPH. And then instead of saying that we recommend that they blindly adopt the recommendations, I would say we recommend that DCC seriously consider adopting the regulatory recommendations provided by this task force. So I don't disregard it, but seriously consider it. And then lastly, we recommend that this work be completed urgently and no later than within the next 12 months. How does that sound?
Hi, this is Angela McIntyre Abbott, counsel for the Department of Cannabis Control. Chair Matthey, would you please restate your motion slower so that staff can record it for the record?
Sure. At this point, I'm not making a motion. I am proposing language for a potential motion that we're still refining a little bit. So, but do you still want me to repeat it again at this point?
If you're still refining it, I think that's fine. But when you make your official motion, please take note that staff will need you to slow down a little bit.
Sounds good.
Thank
Okay.
you.
Thank you. Okay. Other members, how does this sound? The revised version sound?
I think it sounds great. I'm wondering with regard to the recommendation at the end, my only concern is that it's not a strong enough recommendation at the end.
About the timeliness?
No, regarding consideration for policy decisions. So I'm wondering, maybe this is more just a general question, if making that portion of the recommendation would be best held until there is a recommendation to BCC, and then the subcommittee meet and make a recommendation based on reviewing it, whether to endorse it or move forward with it, or just take it as consideration in their policy decisions. But overall, the other sections I thought were well worded and captured what I was looking for.
That makes sense
Yeah,
to me. Mm-hmm. Go ahead.
Sorry, I would tend to agree with that. I had a presumption that the subcommittee would kind of be ongoing, and at the end of that process, whatever CDPH comes out with, that they would either report back to the subcommittee or to the larger committee as a whole body, and that their recommendations could be considered at that time. I do think that they should be seriously considered and not dismissed out of hand. I'm mindful that there's a public perception that recommendations made by the committee have been dismissed out of hand by the DCC or others, and I don't think that's the case. But not every there might be a reason that other places have had recommendations and not pursued them as a matter of policy, and whether that's because they disagreed with the recommendations or complex things are difficult, so we just table it. I don't think that's a good answer, but it is a very complex issue that has, wide-ranging ramifications when you apply it statewide. So I really would like to see what those recommendations would look like after their process. It would be difficult for me to support the inclusion of that in one motion, but the other three parts I do support.
Okay, that makes good sense to me. And I think, yes, the intention is for this subcommittee to be ongoing. So at the time at which those recommendations come out, we can talk about them and make recommendations based on what any report that comes out of this work. So I agree with that. Okay, so at this point, I would like to make a motion, and I'm going to read it very slowly for the DCC staff to write it down. Okay. So the CAC Public Health and Community Impacts Subcommittee recommends that DCC continue to work with the California Department of Public Health to convene a balanced expert scientific task force exempt from conflicts of interests, i.e., no financial interest in high potency cannabis products, to review the scientific literature on the issue of increasingly high THC potency of cannabis products, and to make public health recommendations to cannabis regulatory agencies and to the public.
Hi,
Am I going?
can you restate it for our staff? Thank you.
Yeah, I'm not done yet. Should I keep going or should I start from the beginning again?
If you could take it from the top slower, there's just a lot there, and we just want to make sure we accurately reflect it for the
Yeah,
record.
is there a way that I can just copy and paste it in a chat or something, or email it, or what would be the best way? Should I just restate it?
You can email it to Shannon, and so that we have a copy of it.
Okay, why
As
don't
you
I'll read it again, but I'll also email it to Shannon right now so that we can confirm. Okay. 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 So let me read it again. The CAC Public Health and Community Impacts Subcommittee recommends that DCC continue to work with the California Department of Public Health to convene a balanced expert scientific task force exempt from conflicts of interest, i.e., no financial interest, to review the scientific literature on the issue of increasingly high THC potency of cannabis products, and to make public health recommendations to cannabis regulatory agencies and to the public. We recommend that this work be a priority for DCC, regardless of funding available from CDPH, we recommend that this work be completed urgently and no later than within the next 12 months. And that's the end of the motion. How are we doing, DCC?
If staff was able to.
Yeah.
Sorry.
Were you able to get all that?
Thank you. We have a copy of the motion.
Great. Okay. So at this point, is there a second for this motion?
Yeah, Member Woolsey, I can second that.
Thank you. All right. So now we go to public comment before we vote. Is that correct?
Yes.
Okay. So let's take this to public comment.
All right. So we are now opening public comment for agenda item number 3. The topic for public comment period is displayed on the slide, so you can keep comments limited to that agenda item and the motion on the table. If you'd like to make a comment, please raise your hand by clicking the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. You will have 2 minutes to speak with a 30-second warning. When your time is up, you will be muted and we will move on to the next request for comment. Each member of the public will have 1 opportunity to speak on each agenda item. And we will kick this off with Sarah Armstrong. I have just sent you a request to unmute.
Thank you. Can you hear me?
Yes, we can.
Great. I'm Sarah Armstrong. I represent ACE's interests in Los Angeles and Ventura counties. I'm very pleased with the motion. It's quite wonderful. However, I hope that all concerned will understand that Dr. Carlini is absolutely right when she says science evolves. The reason I know this is Normal every week publishes a free newsletter. Anybody can sign up, and they are very, very careful to note any new studies relating to cannabis, whether they're favorable or unfavorable, and they give you a link to the actual study. Quite often it's behind a paywall, but there's always a detailed abstract that you can read. I read these all the time, and it's more than confusing because on one date you'll see a study that says, oh, cannabis is bad for one reason, then a month later there's another study that says it's good. I hope that as you move forward, you will find a way to capture these studies and the links to the actual published findings so that all concerned can see how things are evolving and have the opportunity to look at reputable studies conducted by neutral parties who are only seeking to find the most recent truth about the scientific progress we're making in relation to cannabis.
30 seconds.
Without this, you may well find that you're making recommendations that are out of step with current science, and this would be quite damaging to all concerned. Thank you for your time.
Thank you. I'm going to take an opportunity to restate the motion on the table at this time. The motion is the CAC, Public Health and Community Impact Subcommittee, recommends that the DCC continue to work with the California Department of Public Health to convene a balanced expert scientific task force exempt from conflict of interest, i.e., no financial interests in high potency cannabis products, to review the scientific literature on the issue of increasingly high THC potency of cannabis products, and to make public health recommendations to cannabis regulatory agencies and to the public. We recommend that this work be a priority for DCC, regardless of funding available from the Department of Public Health. We recommend that this work be completed urgently and no later than the next 12 months. So with that, we will continue public comment on agenda item number 3 and the restated motion. Dale Geiringer, I have just sent you a request to unmute.
Yeah, Dale Gehringer with California Normal again. Just picking up on this item about published scientific research. I'm sort of disturbed listening to Dr. Carlini's talk that she didn't seem to have any information at all about the actual dosage of THC that was delivered by certain high potency products, in particular cannabis vape pens. And in fact, most vape pens that we've investigated deliver very low, moderate dosages of THC per puff. Yet there are vape pens that do deliver very high dosages. So distinctions need to be made, but the fact that there is no published literature on this has to do with federal research restrictions, which have made it impossible to actually do published research. But there is other kinds of research available, and I would urge the committee and the CDPH to look at some of these non-published sources as well when they consider the actual harms and potential harms from exposure to too much THC from vape products in particular. The published literature is not doesn't
30
give you
seconds.
a handle on what's going on necessarily. Thank you.
Thank you. Ellen Comp, I've sent you a request to unmute.
Hi, Ellen Comp,
Hi.
also from Cal Normal. Yeah, I just wanted to comment on the point that Dr. Carlini made about the cannabis industry disputing the science, and we're often lumped in with the cannabis industry, even though we don't profit from it. I would like to say that for myself, and I know for Dale, who's a PhD, then I have a degree in biochemistry. We're very respectful of the science, and we do scrutinize the science very carefully, sometimes with a different lens or with a different understanding that I think can be helpful. For example, we put an input on a bill from Senator Laird this month to actually strengthen it, to make a pamphlet, not just a label, which doesn't seem to be very helpful, but an informational pamphlet available. And we've been working on a high dosage pamphlet as well. Or yeah, because dosage is the issue. I don't think we're overcomplicating it. I think it's complicated. There are some concerns about bringing in models from, say, tobacco. For example, raising taxes on a product when you're going against an illicit market is very different than raising taxes on a product, which I think has been successful for tobacco. I'm also very disturbed about CDPH conflating cannabis smoke with tobacco smoke, often using tobacco education funds to put out information that we have looked at carefully and disputed about the relative harms of those two things. And that has kept cannabis consumption rooms and things and dispensaries from opening in a lot of cities and counties, which we think in the end actually increases public harm. So I hope we can keep the conversation going in other forums. And thanks for this morning's presentation, and also to Dr. Carlini.
Thank you. Jason Sharush, I've just sent you a request to unmute.
Subcommittee members, thank you for this opportunity to speak. My name is RS Jason Sarush. I'm a policy researcher from the Public Health Institute. I'd like to express my support for this motion, and I'd also like to suggest that the Public Health and Community Impact Subcommittee add a standing agenda item to report on any progress made related to this task force and ultimate adoption of any recommendations that the task force makes. Thank you so much.
Thank you. Judy Strange, I've just sent you a request to unmute.
Good morning. On behalf of coastal community parents, I would like to add my voice of support for the resolution on the table. I particularly appreciated the phrase about there not having a financial interest. As parents, we feel beleaguered and disrespected because we have no money involved in this. We're just trying to protect our children, and the people we find ourselves in conversation with make money from selling pot. And of course, make money from people being addicted to it, so wanting more of it. So whether there's financial interest in the information being provided is an extremely important part of that resolution. Thank you.
Thank you.
Thank you.
Kelly McCormick, I've sent you a request to unmute.
I'm a member of a community coalition, and I support this motion. I hope it can take place soon. As you mentioned, the 6-month time frame, for example, since the California Department of Health created their task force to when it was discussed today. So I hope this can proceed at a faster pace. And I also urge that the public health and scientific voice be the #1 barometer of where these decisions go, because obviously the marijuana industry has a vested financial interest. So please put priority on the voice of public health and scientific research. And you will find that there is plenty of scientific research linking high potency THC concentrates to mental health issues in children, as Dr. Carlini expressed. Thank you.
Thank you. Lily and Grace, I've sent you a request to unmute.
Appreciate all of the work I have heard and seen on this panel this morning. I would like to ask one question first. Are the slides available? Two, in the consideration of this, is there a component that will be a teachable, will there be a teachable component in place in consideration of this for the industry professionals at some point? That is all. Thank you.
Thank you. And KC, I've sent you a request to unmute.
Subcommittee for agendizing this important discussion. It's a discussion that we've needed here for many, many years. And so I'm so excited to see that we're finally talking about the concern that we have as parents that these high potency THC products are being marketed to our youth on billboards, on all types of social media platforms with their fruity flavors. They look so fun and attractive to our young people. And what they don't know is that many of them are potent and are doing so much harm to their developing brains. So I appreciate your time and effort in trying to protect our young people against an industry that puts profits before public health. So I thank you for your work and look forward to continuing to have this important discussion that is free from industry influence, who only wants to see their industry grow and marijuana becoming more mainstream and normalized, all to the detriment of our young people. Thank you.
Thank you.
Is that the last of the public comments? Hello?
Oh, excuse me.
Sorry.
All right. So we need to go back. That is the end of the public comments for agenda item number 3. We need to go back to agenda item number 2, which is items not on today's agenda.
Hi, sorry to interrupt. This is Angela McIntyre, counsel for the department. We should actually take a vote on the motion that is on the floor before we proceed with moving on to the next agenda item.
So seeing no more public comment, this agenda item is closed. Moderator, can you please read back the motion and call the roll, and then we'll vote?
Yes.
Thank you.
The CAC Public Health and Community Impact Subcommittee recommends that the DCC continue to work with the CDPH to convene a balanced, expert, scientific task force exempt from conflict of interest, i.e. no financial interests in high potency cannabis products, to review the scientific literature on the issue of increasingly high THC potency of cannabis products and to make public health recommendations to cannabis regulatory agencies and to the public. We recommend that this work be a priority for DCC, regardless of funding available from CDPH. And we also recommend that this work be completed urgently and no later than in the next 12 months. So with that said, I'm going to go through the roll. Chair Mathey?
Present?
And do you?
Oh, I vote yes.
Member Bauer?
Aye.
Member Tupy?
Aye.
And Member Woolsey?
Hi, this is Angela McIntyre, Abbott, counsel for the department. Our staff would like to confirm who seconded the motion for the record. Okay, thank you.
You're welcome.
And Member Woolsey.
Aye.
So the motion passes.
Motion passes. Thank you all. And with that, we will close agenda item number 4 and we will move back to agenda item number 2, public comment for items not on the agenda.
All right, thank you. Members of the public, we are taking public comment on agenda item number 2. If you'd like to make a comment, please raise your hand by clicking the hand icon next to your name or by pressing *3 if you've called into the meeting. You'll have 2 minutes to speak with a 30-second warning. When your time is up, you will be muted and we'll move on to the next request for comment. So at this point, Lily and Grace, I've just sent you a request to unmute.
Good morning. Again, this is Lillian Grace, and my pertinent question for items that are not on today's agenda are related to the collaboration between the two entities we are listening to today regarding the scientific pieces. Will those be discussed in a manner that can be, I guess, facilitated from the state regulatory space? And what bridge of time will be allowed to construct that facilitation by the authority agencies before it reaches the licensees? I think it's pertinent that the transfer of information between the licensees and the committees that design the information be up to date, not so much as up to date, but be diligently handled after it is implemented by the state authority or regulatory agencies to close that gap in the learning module for how to operate. That is all.
All right, thank you. Next commenter is Talia D'Amato. Just sent you a request to unmute.
Hi, everyone. Good morning. My name is Talia D'Amato. I am speaking today on behalf of the Pet Cannabis Coalition. We would just like to note that we believe lack of access to and proper labeling of cannabis products for animals is a part of the broader discussion around the dosage issue. And we would just also like to note that AB 1885, which was signed last year, is only step 1 of addressing these issues. We see the same thing with pets, where when you don't have proper labeling and dosage, you can end up with misdoses accidentally. And we don't want this because it's medicine when it's used properly. We ask that this committee consider adding pet cannabis as a segment of its ongoing discussion and consult with the Pet Cannabis Coalition when doing so, as we do consist of cannabis veterinary professionals with 8 years of experience in this field. Our network, and thus our knowledge, extends into Latin America, which in many places is further along in using cannabis for multiple species than we are in California. Thank you.
Thank you. Any more comment on agenda item number 2? Judy Strang, I just sent you a request to unmute.
I'd love to share my thoughts on this, but I'm not very eloquent. So I'm hoping I can express my concern regarding the language around equity in public health. And maybe this isn't a place for the subcommittee to discuss it, but I've worked for decades on behalf of the Hispanic Latino community. And I'm concerned that they're being used in the conversation as a tool to promote marijuana businesses, that somehow they would want marijuana businesses as some sort of reparations for discrimination that they've experienced for so long. And I'm concerned because the evidence doesn't support that by any stretch. And for those of us who've worked on behalf of communities of color, we're gravely concerned that these conversations around equity and that the best thing we could do for communities of colors is give them the opportunity to own a pot shop is doing far more damage than good. This is not what this community wants. It's certainly not what they need, and it just flies in the face of all public health evidence and data. And probably this isn't the right subcommittee, but it's really hard on us who want to advance good public health policies for communities of color. And this isn't doing that. It's
30
doing
seconds.
damage. So I put it on the table just as a person who's worked for such a long time on behalf of, in this case, of the Hispanic Latino community.
Thank you. Last call for public comment on agenda item number 2. Chair, we have no more comments. Would you like to close public comment on agenda item number 2?
Thank you, moderator. Yes, let's close public comment on agenda item number 2. I want to offer a 5-minute break before we move on to agenda item number 5. So let's reconvene at 11:35 to finish the last 2 items on our agenda. Thank you. Okay, it's 11:35. We are returning from our break. Moderator, do we need to call the roll at this point?
Yes, we do.
Okay, please go ahead and call the roll. Thank you.
All righty. Well, Chair Mathey, we know you're here. Member Bauer?
Present.
Member Christensen? Member Tupy?
Present.
And Member Woolsey?
Present.
All right, quorum has been established.
Thank you. Okay, so we are now moving on to agenda item number 5, recommendations for future agenda items. We established a robust list of agenda topics at our first subcommittee meeting, but I wanted to give members the chance to suggest any additional topics that they would be interested in discussing. So members, the floor is open for discussion.
This is Member Tupy. I thought I recalled that there were some other maybe folks that were going to speak to some of the other agenda items. Is that accurate? I don't recall the entire list that we had said we were going to discuss.
Other folks that were going to speak on the agenda items today?
No, for future meetings, kind of experts in the area.
So at this point, we don't have any further experts in the area of potency planned for future meetings, but if there's a need for additional experts in specific areas, we can definitely do that at future meetings. So so this would be your opportunity to call for that if there was a specific area. We have our list of priority topics that we identified at our first subcommittee meeting, which included things like youth access and enforcement and lookalike products and things like that. And so all of those are candidates for future meetings. And I think we also agree that continuing to discuss cannabis potency would also be on a priority agenda item for our next subcommittee meeting.
This is Member Bauer. I think we would like to prioritize public safety from a worker perspective, looking at worker about how it affects public safety. I think it kind of connects to enforcement. And worker safety issues are a lot of them are with non-licensed businesses, so I'm happy to kind of help facilitate worker stories or some concerns in building that agenda, but would like to see that prioritized for future meetings.
Thank you for that suggestion, Member Bauer. There are 2 other items that I would like to suggest. One is to have an update and check in on the potency think tank. So our next subcommittee meeting will probably be July or August. And so at that point, I would like to see an update on what's been happening with the potency think tank. And then I also want to raise the issue of enforcement that came up a lot today in public comment, and it also relates strongly to a lot of the issues around high potency products. And so I would love to see that further discussion on that issue prioritized as well.
And this is Member Woolsey on that topic. If we're able to, if that's going to be an agenda item. When I hear enforcement, there are 2 types of enforcement that come to mind. And so I just wanted to clarify, I think they're both important. They're both equally important to a healthy, marketplace and healthy program. And that's the enforcement of illegal operators, but also enforcement of compliance and making sure that the legal operators who have licenses are doing what they need to do to maintain those licenses. If we don't look at that enforcement component, then having a license has less meaning. And I think that the public and the consumers deserve to have a license that has meaning when we encourage them to buy from that legal market. So to the extent that we could talk about both of those, they don't have to be necessarily in the same conversation, but when we talk about enforcement, I'd like to know which enforcement we're talking about or if it's both.
Thank you for that excellent suggestion, Member Woolsey.
I strongly support Member
Any
Woolsey.
further future agenda items that any members, subcommittee members would like to
I
discuss?
think I heard maybe Member Bauer on the phone. It's really low volume, but someone was trying to say something.
Sorry, I think it's my driving in the car. I just said I strongly support Member Woolsey's distinction on those two parallel paths of looking at enforcement.
Thank you, Member Bauer. Member Tupi, do you have anything to add?
Sorry.
Oh, sorry.
Sorry, I just had a thought on the compliance side of enforcement. There is a tie there, perhaps with youth access, and the decoys are really difficult to do. They sound really easy, but behind the scenes, there's some complexity to them that has to be addressed. But to the extent that those two topics kind of interweave to some point, that could be a prioritized agenda item that kind of gets at two birds with one stone, so to speak.
Excellent. Thank you for that suggestion.
Yeah, I would just, excuse me, I would just reiterate support from what Member Woolsey had brought up with regard to enforcement and distinction there.
Excellent. Thank you. All right. Seeing no further comments or discussion on future agenda items, we will now hear from the public. Moderator, can you please open the floor for public comment?
Yes, absolutely. We are now taking public comment on agenda item number 5. If you'd like to make a comment, please raise your hand by clicking the hand icon next to your name or by pressing *3 if you've called into the meeting. As noted, you'll have 2 minutes to speak with a 30-second warning, and when your time is up, you'll be muted and we will move on to the next request for comment. Let's move into that. Judy Strain, just sent you a request to unmute.
Keeping in mind that this is the Public Health and Community Impact Subcommittee, first of all the items that you originally adopted, of course, are still wonderful, so I don't want to negate that. However, I'm reminded of a program that happens here in our communities that's funded by the State Department of Justice for tobacco minor decoy operations. And it's far more straightforward than perhaps we realize. I've watched it here in our own community, our own county. And so maybe that's something we could learn more about and duplicate it for marijuana minor decoy operations. Thank you.
Thank you. Kelly McCormick, I've sent you a request to unmute.
Hello, thank you. This is Kelly McCormick. I would like to see enforcement on a future agenda, and I agree with the caller who earlier said that there are complications, or the committee member who talked about the complications with minor decoy operations. Those do exist. However, they can be overcome. And I would like to point out that the San Diego County Sheriff's Department, the substation in Vista, did perform undercover operations, and they have expressed that they would be happy to share, with other law enforcement agencies how they were able to implement their minor decoy operations. So it can be done, and it has been done. And theirs happened to be on delivery services for permitted businesses. Of course, we also need to see enforcement in minor decoy operations on the unpermitted businesses as well. But a model does exist, and it can be followed by other law enforcement agencies. Thank you.
Thank you. Ellen Comp, I've sent you a request to unmute.
You hear me?
Yes.
Sorry, me again. I've just heard so many stories of compliant businesses telling me, regulators are there worried about the height of the shelf or something when down the street there's several illicit operators doing very dangerous things. So I would really like to see enforcement against these operations that are not licensed at all. I don't see the need for minor decoy operations for licensed businesses because every study I've seen shows that there's really no minors being let in at all. And I would like to say too that it came out in the discussion of the Laird bill as a suggestion by Assemblymember Alex Lee that it's possibly the copycat items that are the problem. This year, this is a bill that's trying to address, minors getting access to edibles and stuff, and there's a lot of discussion about whether those are only in the illicit market. I've been doing my own, studies going into dispensaries and seeing not really a problem there, but that's something that maybe should be addressed in a future meeting as one of your priorities. Thank you.
Thank you. Lily and Grace, I've sent you a request to unmute.
Again, thank you for all of the information that you're providing today on this platform. I think that all of us have items that we haven't considered before, and it is with much appreciation that I ask, when will the consideration for an overall regulatory education platform be developed and discussed to be implemented with the licensees or the applicants so that we can consciously walk through this process, that someone within the licensing process deems it fit to have a necessary level of comprehension, at least for the state of California, if not further, that has an implementation plan with the revisions and implementing an education operational guide that gives them the understanding not only to the protocols and policies for operating their licensed business, but also the consistent education as to the requirements for the state of California. That is all. Thank you.
Thank you. All right, we are taking public comment on agenda item number 5. Sarah Armstrong, just sent you a request to unmute.
Sarah Armstrong, representing Americans for Safe Access in Ventura and Los Angeles counties. Can you hear me okay? Yes.
Yes, ma'am.
I would like to suggest as a topic for future consideration, testimony by 2 organizations that diligently collect data on consumers and spending habits in the cannabis space. New Frontiers, Dr. Amanda Ryman is a wonderful source of who's buying what, how often, and what they're paying. Likewise, Headset, which taps into point of sale systems, also can provide you with relevant and timely data on the cannabis marketplace. This is important because as you read through these reports that they issue for free and you watch their webinars on these subjects, you acquire a wealth of information about the actual marketplace itself. And it's important to know who's buying what, how often, what they're spending, and where the upward trends are. I would ask the committee to invite both Headset and New Frontier to do presentations so that you understand their methodology and maybe learn more about their most recent findings. Thank you for your time.
Thank you. All right, Chair, I do not see any more requests for public comment. Oh, one moment. Jason Sharouche just sent you a request to unmute.
Thank you. Subcommittee members, thank you again for this opportunity to speak. My name is RS Jason Sarouche. I'm a policy researcher from the Public Health Institute. And given the motion that just passed unanimously, I'd like to suggest that the Public Health and Community Impact Subcommittee add a standing agenda item to report on any progress made related to the Expert Scientific Task Force and discuss their recommendations. Thank you so much.
Thank you. All right, last call for agenda item number 5. All right, would you like to close public comment on agenda item number 5?
Please.
All right, it is now closed.
Thank you, members in the public, for your suggestions. With that, we can adjourn. Members, thank you very much for your time today. I look forward to working with you all in the future. And this meeting is now adjourned.